I'm really glad to have some chance to present some information about fertility. And I'm Dr. Koo in Maria Fertility Hospital. And today I will explain you about normal fertility procedure and several procedures such as IUI and IVF. First I will introduce our Maria Fertility Hospital. Our center is one of the largest fertility center in Korea. More than 13,000 cases of egg retrieval was performed in 2013, and about 1,500 patients visit our center every day. And our Maria Hospital was established in 1966, and since 1989 IVF procedure was done in our center, and in 2010 more than 50,000 IVF babies in IVF program were born. We have many centers in Korea, and one in Beijing and one in New York. So our Maria Fertility Hospital is specialized only for the infertile couples, so you don't have to be stressed to meet some pregnant women in our hospital. And we have some simple procedure, safe and efficient patient-oriented procedure. So usually with IVF, several blood work is necessary, but we minimize blood work for IVF itself. So no blood work, or only 1 or 2 times of blood work would be enough for IVF in our hospital. And sometimes natural IVF cycle is also possible. This is unstimulated, so it's comfortable and more patient-friendly method. Then I will explain you about natural pregnancy procedure. You can see uterus, tubes. This is ovary. So in the ovary, there are many eggs inside them, and at first multiple follicles are selected, and between them one dominant follicle is selected, and with natural cycle this one follicle grows, and inside it egg is matured. Then this matured egg is ovulated. This ovulated egg enters the tube, and then sperm comes in, they meet in the tube, then embryo is made, and this embryo is implanted. That's the procedure of natural pregnancy. And about infertility, what's this? Infertility is a condition called after 1 year of unprotected intercourse, but still did not pregnant, then we call it as infertility. About 10 to 15 couples of all reproductive age has conditions such as infertility. This graph shows pregnancy rate after 1 month, 6 months, 9 months. So 1 year. After 1 year, about 85 to 90% of couples are pregnant. So this percentage is infertile couples. Cause of infertility, usually except for unexplained infertility, usually male factor is approximately half of total causes. So about half female cause, about half male cause. In the female causes, there are some tubal causes and ovulatory factors. Those are major causes of infertility. Diagnosis of infertility. For men, semen analysis is enough, but for women, we have to do several diagnostic procedures. To check ovarian function, we usually do ultrasound and hormonal assay with blood test. For tubes, hysterosalpingography is recommended, or sometimes diagnostic laparoscopy is recommended, but not in all cases. Hysterosalpingography would be enough in most cases. To check uterus, we check hysterosalpingography and ultrasound. So after workup, what do we do? These are fertility treatment procedures. First, ovulation induction. So making many eggs to be ovulated and trying naturally. This is ovulation induction. And IUI and IVF. There are several methods in IVF, and sometimes operation is recommended for some couples. I will explain you from IUI. IUI procedure is just like this. The basic concept of IUI is this. So semen is prepared and good sperms are inserted into the uterus. So somebody can ask me that, then what's the difference between IUI and natural trial? With natural trial, sperms are ejaculated into the vagina. These sperms cannot fertilize eggs because they have to be transformed during traveling. So this transformation procedures sometimes have problems. So for those couples with problems with those kind of procedure can be helpful with IUI. With IUI, we prepare sperms in vitro, and these transformed sperms are injected into the uterus. So that's the IUI procedure. And one more difference is ovulation induction. So with transvaginal ultrasound, we can give you oral medication or injections to make multiple follicles to grow. And at the just right timing, we are doing IUI procedure. So with many eggs and with the right timing and prepared sperms, we can increase the pregnancy rate. So efficacy of IUI is shown in this slide. And unexplained infertility couples can be pregnant, but its pregnancy rate is low, as 2 to 4%. With natural IUI, means no medication, just IUI, can increase pregnancy, but not so much. With oral medication, it could be higher. With oral medication and injections, pregnancy is as high as 15 to 25%. So I usually recommend for IUI patients to use ovulation induction. Okay, so there are several questions, and first, when is the best timing for IUI, before or after ovulation? It doesn't matter. We can do it before or after ovulation. Sometimes IUI was done twice a day, but it was compared with doing IUI once a day, and pregnancy rate was just the same. So we are doing only once a day. Okay, and bed rest after IUI, you don't have to. Just maintaining usual activities are recommended, but sometimes who wants bed rest? It's not harmful, so you can do it, but you don't have to. Every month, it is possible if ovaries are fine. So after checking ultrasound on the third day, second or third day, then if ovaries are fine, then we can do every month. But you don't have to do it every month. So you can rest 1 to 2 months. It doesn't matter. And how many times? Usually 3 times of IUI is recommended, because cumulative pregnancy rate increases high until 3rd cycles, but from the 4th cycles, the increment of pregnancy rate is slower, and after 6 cycles of IUI, usually they are not pregnant after IUI. So in that case, maybe usually after 3 cycles of IUI, IVF is recommended. So this is in vitro fertilization, IVF. Okay, so this is uterus, and also inside, this is ovary, I'm sorry. Inside the ovary, many follicles are selected. With natural cycle, only 1 follicle is selected, but with injections for ovarian stimulation, multiple follicle is selected to grow. So multiple follicle is developed, and inside them, multiple eggs are here. So on the ovum pickup day, we pick up all the eggs outside of the body, and in vitro, we fertilize them with sperms. So we can have many eggs, and among them we select the best one to be transferred. And if we still have good embryos, then we can cryopreserve them for the next trial or for the next baby. Okay, so this is our Maria Fertility Hospital strategy, and we offer several services for our patients. One is Guardian System and one is Mind Body Center. Guardian System. Sometimes it happens that the IVF mix-up can be happen. So the wrong baby is inserted into the wrong uterus. It sometimes happens. So these are some kind of newses about mix-up babies. So it's a real tragedy for all of the family when it happens. So to prevent mix-up babies, we use Guardian System. So we produce this QR code, and this code is attached to the wristband and matching with sperm samples. And for every samples, we use this QR code. So in every step, we match to prevent mix-ups. Okay, so we have several services in Mind Body Center. Some music, laughter therapy, yoga therapy, art therapy, and nutritional counseling, and some psychotherapy. So there are many services, but I'm sorry, it's in Korean now. But yes, we have some music therapy, and it's in English. Yes, when you get stressed, then heart rate increases and other, it's not good. But with relaxation, with music therapy or something, the mind and body goes better. And these can be related with relaxation response, and it can increase pregnancy rate also. So for music therapy, we are doing music therapy session in English at 11 a.m. We also produced some CD, so English music therapy CD is available, so you can do it. And natural IVF. Usually with IVF, ovarian stimulation is recommended, but sometimes we can do IVF without stimulation, and sometimes in vitro maturation is done. So I told you that with growth of follicles, mature eggs are retrieved with ovum pickup. Sometimes we can retrieve immature oocytes, and they can be matured in vitro. That's the in vitro maturation. But not all the fertility centers can do that. And our Maria Hospital is a specialist for in vitro maturation. So we can reduce the medication. And this OHSS is a severe syndrome which can be occurred after high dose of ovarian stimulation drugs. But without drugs, no OHSS. And in our center, over 3,000 cycles were performed with IVM procedure. More than 400 healthy baby was born. But unfortunately, it is not for all patients, and we have some indication for IVM. Okay, and and we have another system to improve pregnancy rate. One is embryoscope. Usually, embryo is selected by monitoring them once a day. But with embryoscope, we can monitor them 24 hours with this machine. Embryos are cultured inside this box, and all the embryos were monitored with this. Okay, so once a day we check embryos to select good embryos, but we can monitor for 24 hours. These are embryos, and depending on the development of embryos, we can select them. So with good morphology and good developmental course, we can check it as a good embryo. But these yellow ones, they are good. They have good shape, but they have abnormal developmental course. So these can be considered to be not to be transferred. So to improve pregnancy rate, we have many strategies. To improve pregnancy rate in IVF procedure, we have to produce many oocytes, and we can improve our fertilization rate with different methods. In selecting good embryos and embryo transfer method, we can use several methods such as this. This is embryoscope, and with fertilization method, we have also several methods. So we are trying to improve our fertilization rate and to offer the best service to the patients. Okay, thank you for listening, and that's all of our presentation. Do you have any other question?
The last slide, I think second last of yeah. So what is the difference between oocyte and embryo?
Oocyte and embryo?
Yeah, what is, they are the same thing or they are different?
Oocyte is egg, and when it is fertilized with sperm, then it is embryo.
Oh, this is just egg.
Yes, this is only egg. This is embryo with sperm. Yes, yes. After fertilization, we call it embryo. You're welcome. And thank you for coming, because you don't have to listen to this presentation.
I think this will be available in video in the website also.
Maybe or not. Okay, then you're welcome. And if you don't have any other questions, then we'll finish our lecture today.
I'm sorry, this music therapy and yoga, all these things are,
free? Yeah.
What is it?
Yes, yes. Not all of them, but music therapy is free.
Yeah.
But you have to buy the CD.
Yeah.
Yes, yes. But before buying CD, it is recommended to take more than one session of music therapy to learn about how to use it.
Yeah. So she can go to
Oh, yes,
home
yes.
and
Yes, yes. Music
it's
therapy.
around 1 hour
could
or
be
as long as you want.
not as long as like that. I think it would be only 20 to 30 minutes, maybe. If she can use it, it's good.
And you also said that there is a counseling kind of
Yes,
period,
counsel.
so she can go and then talk.
But it's not in English, it's only in Korean.